News, putting North Dakota first.
Our guest for our KX conversation tonight is Dr. Joan Connell. She is a pediatrician in Bismarck and a field medical officer for the North Dakota Department of Health. Hello, Dr. Connell. How are you tonight?
I'm great. Thanks so much for having me.
Certainly. Let's start with a question of time. Now, assuming the state and the governor's new orders work, how long before we can expect to see new cases and hospitalizations and deaths turn around?
Well, we typically think that 2 reproductive cycles of the viral incubation period, which is 14 days, are necessary to see the effects of any significant intervention like this. So 2 reproductive periods would be 28 days. So we're hoping that by December 13th, when these executive orders are going to be reviewed, if everyone is compliant with them, we'll see a significant decrease in case rates, hospitalizations, and then trailing behind that, deaths from coronavirus.
And on that note, do you think the new health order and executive orders go far enough?
Well, I think they are significant, and I think that if they were complied with, we would see significant decreases in case rates, hospitalizations, and deaths.
And speaking of which, if someone has already had COVID and recovered from it, what should their mask-wearing policy be?
Well, it's important to be as healthy as you can be right now, because not only are people getting hospitalized with COVID, but they're getting hospitalized with other illnesses. And as I'm sure you're aware, hospital capacity is at a premium right now. So I would recommend wearing a mask during this point in time, using great hand hygiene, disinfecting your surfaces frequently to stay healthy from all infectious viruses.
Now, of course, the bright spot has been the news about the vaccines on the way. In general, are you feeling more optimistic or pessimistic about the pandemic these days?
Well, I think that the next few months are going to be very difficult because I think that we're going to have to be very aggressive about complying with the mitigation strategies to avoid a lot of heartbreak. And I think that's hard for everyone. It's hard around Thanksgiving. It's difficult around Christmas time. It's very difficult to make those choices during these exciting sports seasons. But we know that coronavirus is more easily spread in the winter months. So we have to be more aggressive with our personal mitigation strategies. If we can do that, then I'm feeling very hopeful that this will be a bridge until we can get the vaccine into North Dakota and into our healthcare workers and long-term care residents first, and then others after that.
Okay, Dr. Joan Connell, thank you very much.
Next.